morning, everyone, and welcome to this IT student chapter event seminar. And we're going to have a guest presentation by Professor Shahram Heydari from University of Southampton. So I was just joking that, I'm trying to remember that, when Shahram was here, Shahram did a PhD with me start in 2013 and finished in 2017. He then went on actually to do a postdoctor at Imperial College. So during the time, and we had a lot of fun, and he did a lot of research, of course, published a lot of papers. And these are just a few moments, and that we had mostly, actually, funny thing that mostly taken during the TRB meeting, not when he was here as a student. And so this is I think one of the year 2018, I think during TRB meeting 2014. And this is 2014, actually, we had a group event and we went out curling. Yeah. And most of them, of course, are gone, and they're working now in the industry or in the university. This is the time that Shahram actually did his PhD defense, 2017. And this actually right before the pandemic, 2020, we had all joined the TRB meetings. And so it's a very nice, nice photo. So anyway, so I think it's great that to have Shahram here to give a talk about his research. I'm sure that you have seen his bio, and he now has expanded his research into kind of wider area, but primarily is on the application of statistics. So he's working on pollution and health and demand forecasting, and in addition to the safety. And he did his PhD primarily on the Bayesian nonparametric approach to road safety study, and did a lot of fancy statistical modeling and so on, published a lot. So Shahram, thanks for giving us the talk, and you can take over now.
Thanks very much. Yeah, the first photograph I remember, it was just before my comprehensive exam.
Oh, okay.
PhD exam, yeah. Yeah. It was stressful, but yeah, we had a meeting in a nice coffee shop, I guess. Yeah. Okay, so I'm gonna share my screen. Okay, so good morning, everyone. I will be giving a presentation on the effect of the recent pandemic on Santander cycles, the London bike sharing system. So COVID has changed many things, among which travel behavior. Due to COVID, stringent measures were introduced in many countries in year 2020. There have been important changes in travel behavior in many urban areas across the globe. In general, mobility has reduced due to lockdown and work from home kind of behavior. As a consequence, public transit service hour capacity and frequency actually decreased in many cities. Also, due to the fear of contracting the virus, there has been a shift from a public transport to other modes of travel, including bike sharing systems. Now, relating to the relation between public transport and bike sharing, in particular, previous research indicates that any disruptions, like strikes, result in an increase in the demand for bike sharing systems. And here, the disruption is the pandemic. Now, this brings us to the research question of the study. Which was basically how was the London bike sharing system affected by the pandemic? And it's not just about knowing whether it was affected or not. More importantly, we need to estimate the magnitude of the effect if we want it to be kind of useful for policy and for future decision making in terms of a new event happens. Now, when it comes to bike sharing systems, usually two important metrics are the number of cycle hires or the demand, and the hire time or trip duration. So in this research, we considered these two measures, while most previous research investigating the effect of COVID only consider the demand. To provide some context, London's bike sharing system, known as Santander Cycles, was launched in July 2010 by Transport for London, TfL, with 5,000 bikes and more than 300 stations. It was a, would say, kind of successful scheme compared to other schemes across the globe, and it has been expanded significantly since 2010. Now there are around 12,000 bikes available, and these are available at around 800 docking stations. Since 2010, there have been more than 87 million cycle hires. So it's quite huge in terms of its contribution to travel in central London in particular. It's well used for commuting trips, and it's part of an important part of the multimodal trips in the Greater London area, in particular central London. Now let's take a look at the data. Here I have two time series of cycle hires, the demand, and cycle hire time. We consider the entire data available from the launch of the bike sharing system in London, July 2010, to the end of December 2020. So the level of aggregation is the data was available at a monthly basis, and in total we have 126 months. We have monthly number of cycle hires and monthly average hire time. If we look at this area of the graph in year 2020, the demand is more or less similar to the previous years. If you look at the time series on the top, the one indicating the number of cycle hires. However, if we look at the blue time series, which represents the trip duration, we see a major shift in year 2020. And at some point, the average monthly hire time goes beyond 35 minutes, which is unprecedented given the lifetime of the London bike sharing system. In this slide, I'm zooming into year 2020. In addition to monthly higher numbers and higher duration, the vertical lines display a series of major COVID-related events, such as lockdowns and ease of lockdown, etc., that happened during that year. So, for example, in March, we had the first lockdown. In June, we had reopening of schools and non-essential shops. And then in November 2020, we had the second lockdown, and it was eased then in December that year. Now, these are observed data. So in order to kind of estimate the change, we need to estimate what would have been if the pandemic had not happened. It's some sort of counterfactual. If we estimate that, then we can obtain the expected change, estimate of expected change. But if you think about this, it's not just about the pandemic as a kind of a single event. Over this period, different policies came into force, and then these were eased. So the effect is not fixed. It varies across the time during this period, and the method that we had to choose needed to be able to kind of account for this variation in the effect. This slide summarizes the methodology. So basically, we use time series data from July 2010 to the end of February 2020, prior to the lockdown. So this is pre-lockdown period. The developed the model, time series model, using a Bayesian, a second order random walk, which I'll explain briefly in the next slide. Once we have the model, we use it to predict for the post-lockdown period. This is from March to December 2020. And finally, we can compare the observed data with the predicted data to understand the magnitude of the change. So the advantage of the method is that it allows capture the varying effect over time for each month during that period. In terms of methodology, we had two outcomes, cycle higher numbers and higher time. Higher time is a continuous variable and for which we can assume it follows a normal density. To kind of make our estimation algorithm more efficient, we standardized the number of cycle hires, which in its original form, usually count regression is used for that, especially Poisson regression in general. But since we standardized that, it becomes continuous, and for that also we assume the normal density. Now, in this relationship here, as you see, YT is the outcome of interest. It follows a normal distribution with a mean, lambda t, and the variance v. Lambda t is given by this equation here, which is a function of a series of covariates x. Beta are coefficients associated with these covariates, including an intercept. And then we have this ut, which actually captures the temporal correlation in the data. UT has a structured specification. It's given here. It's a second order random walk, which simply means that if you consider time t, ut depends on ut plus 1, ut plus 2, ut minus 1, and ut minus 2. So there are two neighbors on each side of an observation that affect that kind of the value of that error term. It's kind of pulling a strength from different areas. And in that sense, it's kind of we end up with a model that is quite appealing in terms of prediction in time series. Then to be able to kind of help prediction, we use a series of explanatory variables as well. Based on literature, we consider the number of variables, including weather-related factors, which are known to play an important role in explaining the demand and a higher duration for bike sharing systems. Then to control for the size of the system, we use the number of docking stations as well as docking points or the number of bikes available at each station, because the number of stations and bikes did not remain the same from 2010 to 2020. They changed over time. They usually increased. So we needed to take that into account. Then we include a series of lag effects. So we consider various lags, for example, lag 1, 2, 3, 6, and 12. And we found that lag 12 actually had an important impact on explaining the demand and higher time. So it's a good actually predictor of the demand and higher time. Basically, it means that if you consider, for example, June 2019, we can say that the demand in June 2019 is a good predictor of the demand in June 2020. And that's, I mean, plausible to assume, because weather conditions are more or less the same, travel patterns are similar. So that's something that we can consider. In fact, we consider that and found that it actually improves the model significantly. Now let's look at the results. Here I have the predicted or counterfactuals versus observed cycle hires. The shaded area displays the 95% Bayesian intervals around the predicted numbers of cycle hires. As you see, in March and April, the observed demand was less than expected, and away from the interval. So we say we saw a kind of a statistically important change in these 2 months in terms of demand. The demand then rebounded from May and remained more or less unchanged over the study period. In November, however, we had a second lockdown, and as you can see, there is a reduction, another reduction in higher numbers. But again, it is within the expected interval. With respect to higher time, we see a different pattern. In March, there is a slight increase in higher time, but the increase is much more significant in April, May, and June. Then it goes back to the shaded area and seems to be more or less similar to what was expected. Also, there is another jump in November when the second lockdown came into force. However, during the second lockdown, trip duration, as you can see, was not affected as it was in April, May, and June. So overall, perhaps an increase in higher time, we can see an increase in overtime over the study period, and that perhaps indicate that people were kind of significantly concerned about contracting the virus on public transit and shifted to bike share for longer trips, obviously weather permitting. Now, to better kind of clarify the magnitude of the change here, I have the estimated posterior densities of the expected changes in terms of values you can see. For example, in April, there were around 360,000 fewer trips. The interval is on the negative side, the 95% Bayesian interval. And with respect to higher time, we observed significant increase in trip duration in April, May, and June. In April, for example, trips were about 17 minutes longer, something that is kind of unprecedented over the more than 10 years of life of a bike sharing system in London. To kind of summarize, overall the demand did not change significantly, which indicates that the London bike sharing system is a resilient transport system. During the post-pandemic period in 2020, bikes were hired for longer trips in general, which indicates a shift from a public transport. So in terms of recommendation, a bike sharing system obviously need to be kind of considered more seriously as part of transportation systems in urban settings. In London, we would suggest expanding the scheme to outer London boroughs. Currently, it is only available in central London. And it's not just about bike sharing, but in general, it's important to promote walking and cycling due to associated health benefits, due to reducing car trips and improving air quality. Thanks very much.
Thank you, Shahram, for a nice presentation. It's certainly very timely. Everybody is interested in the impact of pandemic on transportation. There seems to be quite a bit of research going on in different countries, and some cases have different policies. So I guess we can open for a few questions.
If you don't mind, I can start. First of all, I wanted to thank you for your great presentation and accepting our invite to give a presentation in our IT chapter. So we are so excited that we can have again this seminars in transportation after a while in IT chapter. So we started with your great presentation. So just a quick question is that what's your expectation? What would be the bike sharing after COVID? Because so far you are just investigated about during the COVID, but what would be the expectation for the future? Do you think that people are going to continue this behavior in future, especially after the price of gas went up, or do you have any other expectation on that? Thanks.
Yeah, thank you. So yeah, that's a good question. So part of the change in in travel behavior is temporary, and part of it could be a lasting, you know. So the hope is that the positive change remains. But as you mentioned, yeah, many people have now experienced bike sharing. I know friends that never touched bikes in London, but now they are using them because somehow they at some point they were kind of obliged to use bikes because they wouldn't trust a tube or a buses to travel around London. But yeah, I mean, a further study is needed to understand if this kind of change in behavior is going to last or not. But overall, it seems that despite its kind of disadvantages, COVID had some advantage in terms of change, bringing like positive behavior in travel at least. Yeah.
Thank you.
Okay, Shahram, in your study, I noticed that you try to incorporate many different factors, especially the weather. And I was just wondering if you had considered that what, during the pandemic, of course, the government usually publishes this, some statistics in terms of the number of people infected, and and also certain kind of policies, restrictions. I was wondering if you had tried to incorporate this as a kind of exploratory variables in your study. Yeah.
Yeah, so if I go back to this slide here, this is what happens in terms of different policies that were in place during that year. So the good thing about the method is actually that we didn't need to actually include this as a kind of as a kind of a explanatory variable as many previous research has done. Okay, and it has its advantages. Uh, because basically what we did is we used pre-pandemic data to calibrate the model and just used it to predict for the post-pandemic period. So actually these variables didn't need to be included in the model. Okay, but there are some studies that include this in the model. For example, as a categorical variable, they put a lockdown in the model and then estimate the effect of the lockdown. But then the issue is that those studies doesn't really imply causality. That's just association that's they are implying. But our study, we can claim that that's a causal inference because we have a counterfactual and we are comparing that the observed values with the counterfactual. So it's kind of implying causality, you know. In that sense is more interesting. Also, a other issue with including these as explanatory variables is that, for example, let's say if you have 100 observations, considering a, let's say, first lockdown as a categorical or dummy variable, you just have one or two data points among like 126 data points, which again doesn't really help in terms of a statistical inference. The precision of the estimation wouldn't be reliable enough. So another reason, again, we use that method was that it better can kind of address these kind of problems.
Yeah.
But another issue that could have been taken into account is, yeah, as you mentioned, the number of coronavirus cases and these kind of things. Yeah, that could be taken into account, probably in parallel to this to provide further insights. You know. Yeah, but we use some sort of a kind of, as you said, it's something interesting that I wanted to do, and we had the data readily available, and the idea was that to make most out of it as quickly as possible. Yeah.
Great, thanks. Now, I was just wondering, do you have access to the actual the cycling data, like for example, the origin destinations of the individual trips? I thought that the spatial element could be quite interesting to look into. Yeah.
Yeah, that's actually a great point. Actually, yeah, so that's the limitation of our study because in order to extract that information, we needed to allocate a lot of resources to extract the data. what I have here is just at an aggregate level. But as you mentioned, yes, if we have we do this analysis at a station level, then we can see what is the difference between different stations on different areas of the city. So for example, where a station is located close to offices which are basically closed, employees are working from home, then that is more affected compared to a station that is located in a residential area, Unfortunately, in our study, we cannot capture that because we are using aggregate data. Yeah, but that's actually important in the future to consider. Yeah.
Good, thanks. Great. Do we have any other questions? Okay. If not, I think we're gonna just wrap up. Shahram, thanks again for taking time to give us a talk, and I hope to see you actually in Washington, D.C. Hope you can make it this time.
Hopefully. Hopefully. No worries. Thanks very much. Thanks for inviting me.
Yeah, thank you.
Thank you. Bye.
Yeah,
Bye-bye.
see you guys.
Bye. Bye-bye.
Yeah.